Hello, my name is Rachel Jones, and I am a Nairobi-based media consultant. And today I have the privilege of interviewing Dr. Thomas Kariuki, who's the director of the newly launched Alliance for Accelerating Excellence in Science in Africa, or AESA. The launch events occurred in Nairobi last week, and I believe that AESA offers an incredible opportunity for scientists to engage with public communities, to help teach the public more about what they do, and for journalists to explore the world of science and research and to create a broad range of content for various platforms. Dr. Kariuki, thank you so much for allowing us to come and interview you today. But first, I want to congratulate you on an incredibly successful launch last week. How do you think things went?
Thank you, Resha, and thank you for the opportunity. I think we are still celebrating in a way because for us it was a big day. As you can imagine, it was the culmination of very many weeks of preparation. We wanted that to be a focus because everything we are doing as AESA is focused on creating the next generation of African leaders in science and technology and innovation. And so having groups being recognized on that day as winners of some of the big programs that we will be implementing was a huge success for us. But then, of course, everything else around the event also went quite well. We were very happy to engage with the media during the media breakfast. We had what I felt was an excellent panel discussion around some of the key issues around the continent. And we had the celebration of probably the biggest symbol of African science to come out of the continent, the Ishango bone, and a very nice ending to it all.
Before we get into details about AESA, can you please share with us some information about yourself, where you're from, your background, and your scientific education and research background?
I am a Kenyan. I was born and grew up and went to early schooling in the Mount Kenya region, which is right smack in the middle of the country. Probably my first natural sighting of a wondrous phenomenon was seeing Mount Kenya. So I can see the big mountain from my house. So I always as I grew up, it was always the backdrop to the whole scenery and geography of the area. It was a good place to grow up. I had a happy childhood. Went to local schools, both for my early education as well as for my early secondary education. Went to a national school, ended up at the University of Nairobi. And I kind of found along the way that I had a knack for sciences, that I was, I always, enthused by science. I had an eye for observation. I got my creative juices going every time I got engaged with science. Along the way also, more mentors who supported me, and I ended up at the University of York in England to do a PhD in immunology. So my career has led me to many places around the world, both for education purposes, but also for work assignments. And when I did my PhD, came back, I worked at the Institute of Primate Research for many years. This is a biomedical facility that is part of the National Museums of Kenya. I started out as a mid-level research scientist, then worked my way up, became head of a department, and eventually became the director of the institute. And the institute has a niche in the sense that it carries out preclinical research that is focused on some of the key challenges of health in Africa. So, for example, they are very strong on infectious diseases, but they also have a very big program on reproductive health. And they are involved in development of vaccines, diagnostics, etc. And so I eventually led the institute for more than 7 years as director. And in that period, tried to expand its remit for science and also to bring a lot of young people into biomedical sciences. And to also deal with the challenges that all African scientists deal with, which is a lack of funding, a lack of direct sufficient support from governments, etc., and trying to achieve international standards, for example, is something that a lot of individuals and institutions in Africa still struggle with.
Can you please explain what AESA is and exactly why it was established and what you hope to accomplish?
The Alliance for Accelerating Excellence in Science in Africa has been formed in response to some of the big challenges for our continent in terms of moving science, technology, and innovation forward. So why focus on this? I don't think there is any debate about what science can achieve for the continent. In my engagements with policymakers and with leaders and with scientists, I get the impression that everybody kind of acknowledges the place of science, technology, and innovation in dealing with some of our socio-economic challenges. Whether we are talking about access to clean water or sanitation, or providing sufficient food and nutrition to our people, or medical health for the continent. And if you look at where we are, we really have big challenges. As a health medical researcher, I know about some of the statistics, the fact that, in Africa, we still have the biggest burden of infectious diseases. 25% of global burden of infectious diseases is in Africa, whether you're talking of malaria or HIV or TB, or even some of the neglected tropical diseases that still ravage the continent. And these are diseases that most people have outside of the continent would not even, or inside of the continent, don't even know how to pronounce them. Things like trypanosomiasis or leishmaniasis or all those other diseases. And so clearly we have our work cut out for ourselves. We need to mobilize all the talent and all the resources we can to start deliberately tackling some of these challenges. So AESA is a response to this. It is a response to say we can focus our energies and our resources and our best talent to solving some of the critical challenges on the continent using a science-led development program. And so we want to focus initially on health, build the capacities. We lack capacity on the continent. We need more people trained as health researchers. In fact, our share of health researchers in the world is even worse. It is 0.1%. So we really must build lots of capacity across the entire continent. Yes, we do have some centers of excellence doing very well. That is good because it means that there are some models we can replicate across the continent and begin to churn out the numbers that we need to drive this agenda forward. We also want to focus on the research inputs because one of the reasons people leave the continent, and I think we lose something like 20,000 professionals every year, whether it's scientists or engineers or other professionals, it's not just because they are poorly rewarded. That is a fact. But it's also because some of the environments that they are working in are actually not up to the right standards. So as a scientist, you need just to be properly rewarded. You are attracted to a career pathway that needs to reward you and make you earn a livelihood. But your day-to-day work also depends on having the research inputs and the right places to work, whether it is equipment, facilities, or your direct research inputs. That is an issue we will address through AESA because the programs we will be supporting will look at the totality of what does it take to actually create a conducive environment for science to thrive on the continent, for research and development to thrive on the continent. It takes three things: a focus on people. That's why we are training more numbers and empowering them so that there are career pathways that lead them to even become research leaders. A focus on programs. So we announced last week some major programs we are going to be supporting. You remember the Deltas program that is being implemented with the support of the Wellcome Trust. We also announced Grad Challenges Africa, a program that is going to be implemented with the support of the Bill and Melinda Gates Foundation. And also, as AESA, we will find ways of complementing these programs and building on them in future. And then a focus on the places that the science is being done, so that we have centers of excellence that are emerging out of these places to support this. So that is AESA. That is what we want to focus on: people, programs, and places.
In my experience, many scientists reject working with journalists because they're afraid that their work will be misinterpreted or reported incorrectly. And this leaves them very wary of interacting with media. What advice would you offer to scientists who may be a bit hesitant to submit to interviews with journalists?
You know, I'm laughing because I have gone through this kind of experience where I actually felt I was, totally misrepresented after talking to journalists. It does happen, but I think we have an obligation as scientists to really work closely with journalists to kind of move this along. I mean, as AESA, our success is going to be very much dependent on how we are able to communicate what it is we are doing, how we are doing it, who we are working with. If this is important to us, it's important to our partners, it is important to governments. Scientists cannot be contented with simply publishing in scientific journals. That is fine for our career growth, and it is part of the demands that our institutions make of us, and it is important because that is the way that science, through the peer review mechanisms, ought to be brought out into the open. But the messages contained in our research articles need to be better articulated to the public and to policymakers as well. I have had occasion to engage with policymakers, and most scientists are just tempted when you publish a paper to then copy it to some policymaker at the Ministry of Health or the Ministry of Science and Technology. The fact of the matter is that they don't read those things. You've got to find a way of distilling that message, focusing on it, and in a way that is better understood by the journalists who communicate to the public, as well as by policymakers who make the decisions about how to keep supporting your research and how to keep supporting your training and whatever else you are doing. So I think that for me is a key to success. But it hinges on both scientists and journalists having the right skills and being able to communicate together. On the one hand, I think scientists need to be trained how to communicate their message. Because sometimes the temptation is for us to use very scientific jargon when we communicate, and we completely lose it. The minute I start talking immunology, which is, most journalists tell me immunology is very difficult to decipher. So the minute I start talking about cellular mechanisms that protect people from malaria, what is that? What is cellular mechanism? I mean, it's okay for that to be in a journal article somewhere, but I have got to be able to articulate better that what I'm actually looking at is a way in which the malaria parasite can be controlled by our bodies and limit infection and limit disease. So we have to find a way of communicating this. I think on the journalist side, if they have the right skills, then they are able to extract these kind of stories from the journalists, even as the journalists sometimes get caught up in their scientific jargons. I think a good journalist can still extract a good story out of that.
The buzzwords today in journalism are multimedia and content. In other words, it's not enough for a reporter anymore to just produce for one medium. They have to do more than just write for their newspaper or report for their radio station or post a few things online. Journalists today really need to learn how to do many things and produce content across many different platforms. How can you encourage journalists to realize that research in science offers an incredible opportunity to produce a broad range of content?
I think that there are many stories to be told, and the frustration that sometimes scientists feel that journalists are not covering what they feel is very important agenda for the continent especially has to do with what I said before, that maybe our level of engagement with journalists needs to improve substantially. And we all need to develop the right skills to be able to engage with others much, much better, because you constantly hear scientists moaning about the lack of coverage on key issues, and the fact that journalists always want to follow politicians and report on their activities, even when there is very little to report about what politicians are doing. But there is also the other side of the story of saying, what as ordinary people can we do? Because one of the greatest tenets of controlling diseases, for example, is the whole area of prevention. So the message of prevention empowers the people. They have the tool within themselves to actually help them and their families to be able to overcome some of these challenges. And within the community level, these are messages that need to go out, that in fact, if you sleep under a bed net, you can protect yourself and your child. So the tool is already available, a bed net, but you as an individual or a family can protect yourself from malaria. You can protect the most vulnerable groups, which are children and pregnant women, if they are all sleeping under a bed net. That messaging and communication needs to go from the scientists to the journalists and to the general public. Then there are stories that can inspire a new generation of scientists on the continent. And remember, Rachel, that many of our scientists are producing world-class science and world-class innovations in a rather difficult environment. I mean, I've worked on this continent, I've worked in Europe, I've worked in the US. And I can make a comparison about the environments in which science is being generated in all those environments. So when you see a world-class publication coming out of Nairobi or Harare or Tunisia or Durban, there is a lot that has gone into that. There has been temptations, for example, for that leading scientist to probably pack their bags and get out of the continent because they did not receive the support they thought they would receive. I mean, these are nice stories to tell because they are very inspiring, especially to a new generation of Africans who don't quite see science as a rewarding career pathway. And then there are the achievers who really have made a transition from, say, being scientists to become institutional leaders. You met President Amina last week, a great scientist who is now president of Mauritius. I mean, her story as a woman scientist is very inspiring to women scientists, that indeed there are many ways of getting to the top. And so I personally feel there are very many stories that could be told. And again, my call would be for journalists and scientists to engage together to make these stories available at a global and continental level.
Next to Kenya, Rwanda seems to be one of the leaders in the East African community in embracing scientific research and then using research-based evidence to try to build creative and innovative and effective public policies. So what would you say to a journalist about the potential that exists in exploring scientific research and then communicating that information to the public?
Rwanda is doing great things, and I am personally very happy to see this because I think we are old enough to remember where this is all coming from and the journey that the Rwandese have made. And I think it boils down to doing the right things again, like I just said. Rwanda, like many other African countries, they have to focus on the people. The greatest asset anyone has are your people. So you have to ask the question, how many scientists do we have in our country? How many scientists are there in Rwanda? How do we increase the numbers to reach what we call a critical mass that can drive the science agenda for the country? You have to focus on the research environments. The University of Rwanda and other places in that country, really we would be very happy to engage with them. At the Academy of Sciences, one of the programs we announced last week being managed out of KwaZulu-Natal, looking at HIV and TB, is connected with the University of Rwanda. And I think that is the sort of networks across countries that we at AESA are very, very keen to establish. And then I would also say, at a very early stage, if scientists and journalists in Rwanda can begin an engagement from an early stage, so that they are engaging with governments and they are also engaging with the public and they are also engaging with the policymakers. That is the right mix for science to thrive in a country like Rwanda. You can get it right from the beginning rather than trying to reshape things when perhaps you've kind of lost the opportunity.
Finally, Dr. Kariuki, do you think that the Alliance for Accelerating Excellence in Science in Africa can do more to help journalists and scientists learn more about each other's professions and then have that benefit the general public?
Let me introduce some terminology to you. We call it in AESA, and from among our partners, we call it scientific citizenship. It is the ability of scientists not just to be able to do their work, but also to be able to communicate that work and to engage with the public and to engage with policymakers. So one of the programs that we announced last week, the Delta's Welcome Trust Supported Program, has a very huge component of scientific citizenship. It is a requirement for those programs to be regularly reporting to us as AESA, as managers of that program, what they are doing in terms of public engagement, what they are doing in terms of popular community engagement or engagement with policymakers. It is a requirement for their reporting. So we at AESA look at this as part of the big advocacy thing that we have to do on the continent. Why is this important? It is important because, like I said, to move this agenda forward, to move from having the lowest number of scientists and engineers in the world at 35 per million inhabitants, it's the lowest in the world, to move to a place where we can even approach, say, the world average of about 800 or 1,000 scientists and engineers per million inhabitants. We need to do a huge advocacy on the continent, and NEPAD, the New Partnership for African Development, is our partner on this. With the AU has endorsed what we AESA are doing, because we need the resources to come in, we need the support of governments, we need investments from businesses, we need more philanthropists to come forward on the continent, like Bill and Melinda Gates have done in the US and created a foundation that is supporting AESA to move this agenda forward. We need all of this. And therefore, we are very focused on advocacy as a key aspect of what we want to achieve on the continent. And that is why partnerships with journalists, partnerships with governments, partnerships with businesses is very critical to us.
Thank you so much, Dr. Kariuki, for allowing me to interview you about this exciting new organization, the Alliance for Accelerating Excellence in Science in Africa. I'm looking forward to learning more about what your organization does, and I'm sure journalists across the continent will benefit.